All right, we're good. All right, y'all. Let us know if y'all can see and hear us. If everything's good. There's a little bit of like a 10-second delay, so stuff in the chat will show up kind of in a minute. But thanks for tuning in, y'all. I'm very excited to have all of you here and introduce you to Kristin, who I met on Instagram not that long ago.
Yeah.
And we have recorded a podcast that you guys will be able to listen to next week, which is going to be more about financial stuff because she is like a pro and you can learn a lot, which we can get into some of that tonight too. And she has a really cool, I mean, I'll let you tell them about it, but a really cool financial course. Like, I think everyone needs a financial literacy course in their life, and we don't really get those. So don't wait till you're 30 years old like me to do it. But we put that in the offer tab for you. And I don't know if you want to say more about that, and then I'll go over some like housekeeping stuff.
Yeah, sure. So my name is Kristin Burton. I'm a practicing pulmonary critical care PA, but I also own a side business. It's a financial coaching company that sort of was founded out of my horrible situation that I found myself in with student loan debt when I finished PA school. And I just recently launched an online course. So in the wake of COVID, it's been difficult to, meet with people and face-to-face. So I decided to try the online course approach to meet more people sort of where they're at.
Awesome. Well, that is in the offers, and make sure you use that code PA promo to get $20 off of that course. And it is coming out very soon officially. It's in like the pre-launch right now. So, all right. I'm going to go over some housekeeping. Where's my little thing? So, if you let me know where you found this event, if it was Instagram or who knows where, I don't even know where else. The Pre-PA Club on Facebook, maybe YouTube, because we posted some of the old ones there, TikTok, wherever. Let us know kind of where y'all are coming from, the email list. But I'm Savannah. I am also a PA. I work in dermatology in Georgia. And I do the PA platform, which is my blog that I talk about all things having to do with pre-PA stuff. So I'm very happy that you guys are here. Thanks for watching and tuning in. Also in the chat, which this is going crazy now, tell me if you are pre-PA or about to start PA school or a PA student. Kind of let me know what stage you're at right now. Actually, probably the easiest way to do that would be a poll. So I'll put a poll up so y'all can tell me. Yes. Cool. Maybe we even have some PAs in here. Who knows? All right, I know that probably doesn't have like all the options, but let me know where you're coming from. All right, so, and if you've been accepted, that counts as PA school. All right, so as far as what this event is, there's been a lot of talk about virtual shadowing, which is kind of what this falls into, because we're going to hear from Kristin a lot about her job and what she does and kind of learn about that. But it's going to be different than if we were actually at her job with her. So in my mind, this is different than a real shadowing where you are able to get in there and kind of see how PAs interact with patients and other people on the healthcare team. So I think it's a great information source, but it's not a substitute for shadowing. So we aren't doing any type of certificates with this, because when you really shadow, you don't get any kind of certificate. We're also not able to validate this as far as if we were contacted, because we can't say 100% whether someone was here or not, or here for the whole time. And so you can list it on your application. How you do that and where you do that is up to you. So if you're doing extracurriculars, if you're doing shadowing, whether or not the school accepts it is also going to vary. So I do recommend checking with a school before you decide to list virtual shadowing on your application. But again, just you're going to hear a lot of information. So this will be sent as a replay link. I believe it goes out in 24 hours. So you will get the link to the replay, and then we'll try to get it up so you can watch it too. All right. So if you stick around to the end, I will tell you about 2 other events coming up, or I'll probably post them on social media at some point. But if you want kind of the inside scoop, we'll make sure you get that. All right. So I think to start, Kristin, let's just hear about kind of what does your job look like? What do you do?
Yeah, so I work, technically I work in pulmonary critical care, but I work nights, and I have this schedule that I actually really love. I work 7 nights on and then 14 nights off, 12-hour shifts, which, believe it or not, is actually considered a 1.0 FTE in full time, which sort of feels like it's cheating. So it's a lot of time off work. So because I work nights and I only work in the hospital, I really don't do a lot of pulmonology. So I would say like probably 85% of my job is just critical care with a little bit of pulmonology sort of sprinkled in. So I came to this position that I'm in now from the same hospital, from doing cardiology, which at that time I was mostly inpatient and a little bit of outpatient. So it wasn't, a ridiculous transition to go from seeing inpatient cardiology patients to doing inpatient critical care.
Interesting. Okay. So that is so different than what I do in my life. Very different jobs and very different roles. All right. And if y'all have any questions, put them in the chat. We have a list that we gathered ahead of time, but we'll try to get to as much as we can. So what would a typical night look like at your job if we were really shadowing you?
Okay, so I get there. I have a colleague who is another PA. She works with me at the same schedule. We work every shift together. And then there is a critical care physician who is on backup call. So they're there in-house in the hospital. When we get there, they cover like a short evening call shift. So the beginning of my shift is basically getting report on incoming patients, who is really sick, etc. And then the whole shift is cross coverage and new admissions and consults, I guess. So basically, our whole pulmonary critical care service in the hospital, we have a list of, X amount of patients. So any question from any nurse on any of those patients gets called to our call pager. And then any new pulmonary critical care consult or admission in the hospital we have to do. So it may come from the ER, it may just be an ICU admission, or it may come from someone who decompensated on another unit. But that's essentially the job. It's cross coverage, putting out fires, and doing new stuff, which is really different from other things I've done before. And most hospital type of jobs which are a lot of rounding. Like, you have a list of patients, you see everyone on your list each day and sort of move them through their hospital stay. Just because I work nights and not days, my job is actually quite a bit different from that.
Interesting. Okay, so someone put in the chat, what is critical care? Are we talking just like ICU type patients?
So the way it ends up in my hospital is it's really anyone that the internal medicine team feels is critically ill. So they don't have to be in the ICU. They can be in a step-down unit. We don't often have floor patients. So if you're not familiar with like the hospital hierarchy, there's ICU, there's step-down, which is progressive care, and then there's the floor, which is like med-surg. So we don't often have med-surg patients, but I would say all ICU goes to us. And then step-down just depends on if internal medicine thinks that they're appropriate or if they think that they should be taken care of by the critical care service.
Okay, cool. So I don't know if you can even answer this, but on an average shift, how many patients are you taking care of?
So it varies dramatically, honestly. Summer is slow as compared to like a global pandemic or a flu season. Yeah. So it wildly varies, but I would say probably the most like new admissions I've gotten in a night was 13 or 14. But when you factor in, like 50 to 100 pages, occasionally, multiple codes, and then, 13 admissions of people who are critically ill and may need procedures done. It's actually a lot of work, even though 13 maybe doesn't sound like that much for a 12-hour shift.
Yeah, it does sound like a lot of work. No, it does. What is your favorite part about your job? You can say the schedule because your schedule is really good.
My schedule is good.
People are commenting on.
I love the procedures, honestly. I do a lot of procedures, which is one of my favorite things. And then, honestly, the other thing is probably just like the acuity. I am kind of an adrenaline junkie, I guess. So I really like that, this patient's massively decompensating right now. We have to intervene. So I love those moments. So probably the true blue critical care when it does happen, and then that and the procedures.
What kind of procedures are you typically doing?
So I have privileges for central lines, central venous lines, arterial lines, intubations, chest tubes, and thoracentesis. Although I do not routinely do thoracentesis at night, not really an emergent procedure. And I do only chest tubes in the emergent setting. In general, all procedures carry risk, so I don't run around at night doing unnecessary things. But so I think probably 85% of my procedures would be central lines, arterial lines, and intubations.
Okay, so what's your role in like a code? Are you running the code or? Yeah. Okay.
We don't have, like I mentioned, our intensivist is on backup call. So they're not in-house. Occasionally somebody from the internal medicine team or the family medicine team will come to a code, but they tend to defer to us just because we do it much more often than they do.
Okay. What about, somebody asked you use bedside ultrasound a lot?
Yes, all the time. Love it. It's one of my favorite kind of tricks. So if you are into point of care ultrasound, critical care is a great place to be. It's becoming really the standard of care to have point of care ultrasound available to you. And at least where I've worked, both the critical care service and the emergency department tend to use it a ton.
Nice. Okay. There's a lot of just kind of straightforward ones coming through, but do you, somebody asked, do you work closely with respiratory therapists? And if so, what does that look like?
Yeah, so the role of the RT, in my experience, varies really dramatically depending on the hospital. I've done moonlighting and worked at smaller outside sort of hospital settings where the respiratory therapists don't do a lot in terms of vent management or airway management, but at my hospital they do. So especially on vent management and airway stuff, we work very closely with the RTs.
Okay, and somebody asked what's the meaning of code. That's when a patient is not doing well, like on TV when you'd see them, doing CPR and pushing medications. Probably the best way.
It's not like it is on TV.
Not like TV. I get it. That's probably the only time you see the code happen. Like where they call over the loudspeaker, code blue, code blue. Yeah. I don't even know if it's blue. A lot of people want to know why you chose this particular specialty. And how long have you been in this specialty?
I've been at this job almost 2 years. And like I said, I came from cardiology. Yeah. I picked this honestly because of the procedural abilities. My previous job, I love cardiology medicine, but wasn't an option for any of their advanced practice providers to do procedures. So I wanted the procedures. I felt like in a subspecialty, I was losing a little bit of the broad base of knowledge that I sort of had coming out. So part of it was wanting to get back to just broad medicine. And then part of it was the schedule. That schedule was like a lot of time off work. So yeah,
that's really nice. So can you pick up shifts or fill in if you want to?
Yeah, yeah. There's always day shifts and night shifts available most of the time for moonlighting. Like we're hiring and then we'll be more fully staffed shortly, but someone's on paternity leave or something. So there's options to pick up, which is nice if you want the increased income for whatever reason.
There are some questions about you working nights, and whether how you adjust from nights to days if you switch? And then also, like, is night shift quieter than day shift? Like, would your job look different if you were on days?
So the first part of the question, it's tough. And honestly, the only reason I feel like I'm able to do nights is because my shifts are blocked together, which for me, that really helps me. I am like religious about my routine when I'm on nights. I switch into night shift the same way every time. I go to bed at the exact same time, wake up at the exact same time. I exercise when I wake up. I stop drinking coffee at 3 a.m. So like I have all these sort of rules that I follow while I'm on nights, and it really helps me get adjusted. But the switching to night shift and the switching back from night shift is the hard part. So the whole idea of like, you know, working Monday night and then working Wednesday night and then working Saturday night, it wouldn't work for me personally. But yeah, having a routine and having them lumped together is how I do it. However, lots of people do it, you know, popcorn shifts, and they're fine. I think it just depends on you and your sleep hygiene and all those things.
Yeah, I couldn't do it. I just don't think I'm cut out for nights. Like 9:30, I'm about done. So I don't know that. And my husband's had to do it, and I'm be honest, he is grumpy.
Really?
Like those switching days are rough. Like
they are
not pleasant. Those are probably actually the most like unpleasant days we've ever had in our marriage, is like the 2 to 3 days when he's trying to switch, and I'm like, you are grumpy. But it's that's a weird thing. Okay, do you feel autonomous at your job?
Yeah, so that's actually one of the reasons that I took this job. You know, in general, there's a wide variety of levels of autonomy in the PA world. Probably, honestly, more so than any other job in all of medicine. Like if you're a physician, it really doesn't matter where you work. You're probably going to do the same thing. If you're a nurse, it doesn't matter. You're going to do the same thing. But for PAs, it's super variable. I knew this group because they came from the same hospital, and I knew that they really valued their PAs and NPs, and I knew that they had them working at kind of the elevated top of their scope of practice, which was one of the big reasons that I wanted to work for the group. So yes, I do have a ton of autonomy, probably more than most PAs or NPs do in a hospital setting. That's as big as the hospital that I'm in. Most of the time in a hospital, when an advanced practice provider has a lot of autonomy, it's often in a smaller center where they have fewer providers overall. So I kind of got lucky. And again, that was one of the reasons that I took this job.
Yeah. Okay. So I know you said there's a doctor who is like technically available or on call. At what point would you maybe need to call him or feel like?
Yeah. So
how often do you call him? I guess I don't know.
There's a wide variety of reasons for me to call, and we have all like very close relationships. They're all extremely supportive and extremely available. So it's not uncommon for me to call just to run a case by them and make sure that I'm not missing things and that they're in agreement with the care plan without them actually necessarily coming in. I have had, situations that are just disastrous where the physician will come in from backup call to be there in-house. But a lot of times it's something where I can say, here's all the things I'm doing. I just want to make sure this person's really sick. Is there anything else that you can think of or that I should be adding on? So sometimes it's just a kind of a phone call staff, which works really well. And honestly, the number of times that I have to call them varies just depending on sort of what's happening at work. Like it's very variable. I never know what I'll necessarily get. So there are days where I'll call them 2 and 3 times in the same shift, and then 2 or 3 days will go by when I won't have to call at all. So it just depends. But honestly, I don't think you could do the job that I am doing if you didn't have really good physician support and know like wholeheartedly that if you run into a situation where you're uncomfortable, that they're going to be available.
Yes. No, I mean, that's so important. What is the hardest thing about your job?
Honestly, so I guess I should have said earlier that I just recently got my colleague partner that's another PA. Previous to that, it was just one person. And so the hardest part of my job was honestly just straight up stress, because I was doing those 13 admissions and the codes and all the procedures all myself, which is a lot of work for one person. So for a long time, it was just extremely stressful. You can only do one thing at a time. So just that, the acuity plus the volume was extremely hard. And then when you factored in COVID, that was a whole new thing. But now that there's two of us, the job is much more manageable.
Yes, that's crazy. I feel like you'd be juggling, like running.
Literally.
Yeah, like actually running. Well, okay, so how did COVID impact your unit or your job?
Yeah, honestly, it was really hard. The initial sort of beginning of it was probably the worst, just because there is massive uncertainty about, you know, what sort of critical care capacity we would reach, and if we would have enough vents, and if our providers would all get sick, and what we would do if we, you know, ran out of people in the hospital that were intubators or vent managers because, you know, people were infected or whatever. So I think that really was the worst part of all of it for me. We did see, you know, initially like a surge, and we had a unit of our hospital that's not normally an ICU sort of converted to critical care. But that was maybe a month. And then fortunately things went back to where we could sort of keep it just within our typical ICU capacity setting.
Yeah, such weird times.
Mm-hmm.
There are some questions about how you deal with burnout or stress, and whether you've kind of experienced burnout in your job.
I have. I think honestly, I feel like if you polled most PAs that have been in practice for several years, there's usually a phase of burnout. It's not like, you know, constant the whole time, but there are just seasons that are stressful, or maybe you have something else going on, like personally, in addition to work, and it becomes overwhelming. But, you know, I've always found that if you take a step back and find ways to sort of reduce your stress, everyone has different ways. I have my, like, you know, 5 podcasts that I listen to, and my bath salts that I like take, whatever. And like, you find ways to relax, and kind of work through it. But there are seasons.
Yeah, I feel that too. How long have you been practicing? I feel
4 years and some change.
Okay, yeah, because I'm at 6 years, and I feel like it was like year, like around 4 or 5, where I was kind of like, oh man, I'm tired. Like,
yeah,
it's just a lot to. I mean, medicine is a lot,
right?
For sure. So let's see. Someone asked, "Are you on call a lot?" I wouldn't think that you would like necessarily take call, right?
No, I don't take any call from home. When I am at work, I take call for the service and carry our call pager, but I don't ever have to take call from home.
Okay. What is one thing you wish people knew about your field of work?
Ooh, about critical care or about being a PA overall?
Maybe either one. I guess PA is a little more general versus
sure,
like critical care.
I think the main thing that I did not know about being a PA before I went to PA school that I learned as I graduated was that you have to be super, you know, choosy with your job, essentially. Like the job, like I mentioned, the jobs for PAs are just really variable. There are places that are incredible to work, and you're valued, and you're treated like an advanced practice provider, and you bring a lot to the table. And then there are places where I personally know PAs or NPs that act as scribes, which is kind of ironic because a lot of people do scribe work before they go to PA school to learn a little bit. So, you know, you just have to really dig in the interview process and get a really good sense of what your job will look like, because as I mentioned, it's still a very variable field of medicine, which for me has been something that I've been able to navigate. It's just a challenge that I didn't know to foresee during my initial going to PA school and first graduating.
Yes, it can definitely, I agree, it can vary a ton based on location, state, physician. I mean, all of those things make I've never actually thought about it like that. Like the way you explain it makes a lot of sense that, like you said, a doctor is going to do what they do, pretty much the same job in different places, nurses, but like PAs can be definitely very, very different.
Right.
Which is interesting. I think this is an interesting question. When you are when you're done with your work week and you come back for your next set of shifts, do you often have the same patients, or usually by then, like, it's completely different?
You know, my hope is that most people are out of the hospital by then, because I've been off for 2 weeks, but it is unfortunately relatively common that the same people will still be in the ICU, especially with COVID, that were there the last week that I was working. So
yeah,
I'm really not, but it does happen.
Okay, interesting. There are also a lot of questions about like how you ended up doing PA. Like, did you consider MD or NP at all? What was your kind of process there in becoming a PA?
Sure. So I was a biology undergrad. So nurse practitioner didn't make a ton of sense for me because I would have to go back and redo basically an undergraduate in nursing. So in order to use the degree that I was already, 3/4 of the way done with, I really considered basically like optometry school, dental school, medical school, or PA school. Ultimately decided I didn't want to look at teeth or eyes all the time. So those were out. And then I know, like, I don't think I would want to do that every day. So then I was really between medical school and PA school. And ultimately, my sort of counselor at college just helped me go through the pros and cons and the differences between the two jobs. And at the time, the average number of hours worked for a PA was much less than a physician. And the sort of ability to laterally move and change subspecialties was really interesting to me, which is harder to do as a physician. So I ended up choosing PA, although to be honest, I wish I would have known a little bit more before I made my decision. It's not that I wouldn't have done the same thing. I just sort of went forward relatively blindly. I wish I would have had more things like this, to talk to practicing PAs and learn a little bit more before jumping in.
What do you wish someone told you or that you would have known, I guess?
It's not really anything in particular. I did a little bit of shadowing here and there, but I never really just dove into like the nuances and the differences in state legislature. And, if you don't want to move, I lived in Indiana, so if you don't want to move, then what is it like for PAs in Indiana? That kind of stuff. The stuff that I gleaned, honestly, was just very surface level before I went forward.
Yeah. Okay. Are there any NPs at your job or no?
Yeah, there are actually a lot of NPs with variable backgrounds. Some of them are acute care NPs, not all. But we all have essentially the same job and work interchangeably. Okay,
so that's my next question it's pretty much y'all function the same same way. Okay, cool. Do you ever wish you went to med school? That's the next question coming up.
No. No, I don't. And if you want to go to med school, that's great. But I work with physicians day in and day out. So I see their job and their day-to-day, and I'm pleased with my decision that I didn't go.
Yes, same. Very same. So being on nights, do you end up speaking to a lot of patients' families?
Yes.
Okay.
Well, that can be one of the tougher parts, especially doing like a new admission for someone who's critically ill and trying to explain to their family the gravity of the situation. So they sort of have a sense of what to expect. It can be one of the more emotionally draining aspects of the job, honestly.
That's hard. I think I may have missed it, or you probably said it, but what are your hours? Like, what time do you go in and what time do you go home?
I work from 8 p.m. to 8 a.m.
Okay. Okay. So you may still get to have dinner at home and then go in. That's nice. Yeah. So what would you have there? Would you call it breakfast or lunch or?
I have lunch there, and then I eat something sort of small, like sort of breakfast, I guess, when everyone else is eating breakfast, and then I go to bed. But I eat, like, my husband works a regular schedule. You know, he gets goes in at 7 and gets up at 4. So we have dinner together. So I have like dinner food for breakfast, basically.
Okay, that messes with my head. So how long will you typically sleep? Like, you'll come home and...
I sleep every single day from 9 to 4.
Okay.
So I literally, I come home, I take a really quick shower, and I'm in bed in like 10 minutes. And I just
that's what's interesting to me about night shift, because when I come home from work, I'm still awake for a good, few hours. But like night shift, that's what my husband do. Like, he come home and he goes to bed. So it's interesting. Yeah. I don't know.
I almost treat it like an evening shift, kind of like where I pretend I'm working till 11, I guess. I don't know.
Yeah. And then you come home and go to bed.
Yeah.
Interesting. Okay. So let's see. We're talking about how weird it's are. So one interesting question, do you still get vacation time?
I do not, but I'm allowed to switch with my colleagues on the other week. So it's actually a really flexible job. If there's a thing I need to do on a weekend that I work, I am able to switch shifts around.
Okay. So that's nice. And I feel like having that type of predictable schedule, you would be able to plan pretty well. But all right. Let's see. I feel like that one is not good. Okay. Do you ever feel scared, or have you had any scary situations?
All the time. All the time.
Oh my gosh, probably every single shift or night.
Yeah, all the time.
Gosh, what in general do your patients typically have? What would their diagnoses be, I guess?
Sure. So I'm mostly in the medical ICU. We have a cardiovascular surgical ICU that I'm not in very often. And then we have a cardiac CCU that I'm in some, and actually probably feel the most comfortable in from my cardiology background. But in the medical ICU, I would say our predominant diagnoses are probably septic shock and cardiac arrest. And then in the CCU, it'll be, cardiac arrest, STEMIs, cardiogenic shock, but I probably, 60% is septic shock, to be honest.
Okay. So just, in that situation, you're just trying to figure out what's going on, keep them stable, get them better, or so I guess is your job more maintenance of the patient overnight versus making decisions in their care? I don't know if that makes sense.
It just depends. If they're already there, they're already established. Yeah. A lot of times we'll get asked questions and we'll be making just really minor changes, like changes to their insulin or changes to their pressors. But then if it's a new admission, then it's a completely unknown diagnosis. You have to figure out, the appropriate resuscitation, the appropriate pressors, the appropriate antibiotics, the appropriate source control. So then you're really driving all of their care. So it really depends kind of on where they're at in their continuum. But if they're already in the ICU, a lot of times it is little stuff.
Okay. Do you see any trauma patients?
So we just became a level 3 trauma center, which has been a whole kind of new world for us. So I just became ATLS certified, which is all new for me as well. And we are seeing some low-grade trauma stuff. But realistically, being only a level 3 trauma center, most real traumas sort of go to a level 1 center or somewhere else.
Okay. So a little bit in there. How do you handle the sad parts of your job, whether that's losing a patient or tough cases? Are you able to leave it at work, or does that kind of affect you?
That actually varies. There are some times that I'm able to leave it at work, but there are cases that will bother me at home. It's just tough. fortunately, like my colleague is extremely supportive, so it helps to talk to her about things, and she's there with me, so she sees everything. And really, everyone in our group, we all have bad cases and bad situations, so they're all supportive too. So I try to talk to really the people at work about it and the other physicians and APPs in my group realistically, because they understand better than anyone else can. I'll talk to my husband a little bit, obviously with no patient identifiers, but it's just different for somebody who's not in the field. So I think the easiest way to sort of navigate it is just to talk it out with somebody who is in a similar position.
Yeah. Okay. In this role, and I guess it may not be yet, but I think it is. How long did it take you to feel comfortable, or was there like a big adjustment period there with switching specialties?
Yeah, there is a big learning curve with any subspecialty switch, critical care definitely included. And I think that the idea that you're going to just arrive at your job one day and be like, today's the day I feel comfortable. It's been 12 months. It just doesn't happen. Comfortable is a continuum, and you get comfortable with, maybe certain sets of diagnoses or certain procedures, but then there's still always things that you're still learning and you still can improve on. So, it's been almost 2 years, and there are certain things that I feel a lot more comfortable with than I did before, but there are always new things. There are always things that come up that I'm like, wow, I could do better. I could learn more, read more. Yeah. Do you agree on that?
I do. And that's what, so like mine, because I went straight into derm. I mean, I think it was like a good 6 months before I even ever had a thought of like, oh, I'm okay. Like it was, I was, I don't know what's the word, like a little baby horse learning to walk, or there's probably a better metaphor, but I don't like just kind of stumbling around and figuring things out, asking lots of questions, studying all the time.
Right.
But it was about like 6 months when I kind of remember having feelings of like, okay, I'm understanding. But even then, like you said, there were things I didn't feel comfortable with. Like at first I didn't really feel comfortable with psoriasis patients, and then I didn't really feel comfortable with pediatric patients. So it was kind of these things that I would realize I had less knowledge, or like a void of knowledge, and then I would really pursue education in those areas to make myself better.
I think when you start a new job, like you have to just take such initiative to learn that field. Like I think I went to 4 conferences in the first 6 months of taking this job, and I spent a ton of time reading and like shadowing the other people that worked on nights and just learning, because I mean, it's new. It's not like, you have this huge fellowship that all the physicians did before they went into this field. So there's a knowledge gap, and you have to sort of motivate yourself to overcome it.
Yes. And that's, I think, just part of being a PA, because you don't, unless you choose to do a program, get the residency experience where everything is packaged and given to you as far as like education, and you're kind of getting that organized learning a little bit more. And I think that's just, part of being a PA, because you come out and you've got to learn a lot. So, neither one of us did residencies or official ones. So, yeah. These are kind of specific. Let's see. Do you and your colleague work together on the same patients, or do you split up?
We mostly split up. When she first came to nights, she had been on days before, and it's just a lot. It's a really different workflow. So at the very beginning, we did a lot of things together. But now that, we've been working together for a while, we usually split patients up. That being said, if someone's really sick or something, is really big is going on with the patient, we usually both go. And then honestly, a lot of times I will, even if I don't call a physician and let them know what's going on, I'll ask her like, hey, I'm doing all these things. What else can you think of? It's just, you don't ever practice in a bubble. And during the day, the whole group that I work for is very cohesive and kind of all sit together in the same room, and they're always bouncing cases off of each other, which was kind of the hard part of working nights, to not have that. So now that I have her there, I tend to do that a lot with her. So she, even though she may not see every patient that I see, she pretty much knows everything about them, because I'll tell her the whole story and tell her all my, management, and make sure that there's nothing else she can think of.
That's a really good example of like the teamwork aspect of healthcare, which I think is so just beneficial to patients, because when you have multiple thoughts and minds involved, you can, I just think that's better. So that's what made me want to be a PA, was seeing that. So I think that's a good example of it. Okay, we have questions on, which I think you're the perfect person to ask. How did you pay off your debt / how did you handle your student loans? So same question asked differently, but what was, you're like very impressive in that field. So
So I went to a private school for PA school, and was fortunate that my parents paid for my undergrad. So all of my student loan debt was from grad school, and I had $161,000 when I was done, which for me is above the national average. And most of mine were private student loans with interest rates like 9-10%. So honestly, I was in a tough spot financially when I finished. And I just decided, early on, like it just wasn't ever on the table for me to take the whole 10, 15 years to pay it off. My minimum payment was, I don't remember, but it was like $2,000 a month. And I just knew that like we weren't going to be able to travel. We weren't going to be able to fix up our house or do any of these things that I always wanted to do if I kept this payment around. So I decided to just hustle and work as much as I could and pay it off as fast as I could. So I was married the whole time. So my husband worked, and we bought like a little foreclosure of a house that he could afford to pay on just his income. And then I worked 4 or 5 jobs, and every single dollar that I made, we put towards my student loan payment. So we were able to pay them off in 16 months, which it was honestly even faster than I planned on. But once I got started, it was like this little momentum roller coaster, and I just kept going and working, and got it done in 16 months.
Which is crazy. But awesome. What jobs were you working then? Like what specialties were those in?
So actually my very first job out of PA school was as a hospitalist PA at a different hospital than where I work now. And I worked 7 on, 7 off day shift. So for a while, that was really nice for picking up extra shifts, and I was just working extra at my primary job. But then the group that I worked for lost the contract with the hospital, and basically my job sort of imploded, and I lost my job by proxy, which was very stressful as a new grad. I'd only been out for 6 months, and I already had to find another new job, and I just found a job. So that's when I moved to cardiology. And then once I did that, I was working Monday through Friday. So it was a little bit harder. Just, I only had my weekends, but I would work, day shift, night shift, whatever shift I could get on the weekends to make as much money as I possibly could.
Gosh, was that hospitalist medicine mainly, or like ER or urgent cares, or?
So it was mostly hospitalist medicine. I did have one PRN in an urgent care. But, the hospitalist stuff was what I was most familiar with. That's what I had done. And even in cardiology, I was working almost entirely in the hospital. So I just felt comfortable there. And it was, PRNs are great, but you have to be able to pick it up quickly. Like no one wants to hire PRN help that needs a bunch of training. Yeah. So for me to sort of stick with what I knew, worked out the best for me.
Yeah, it definitely worked out. I love your story. I think it's so impressive. That's actually made me notice you on social media. I was like, what is she posting? Like, what is this? This is crazy. But I'm very interested in financial stuff, but not nearly as savvy or knowledgeable as you. So it was a good, I'm glad I found you on Instagram. But she's on Instagram at Strive with Kristin. If y'all want to follow her, because she posts so many. So it's all like financial tips and tricks and like great stuff. So definitely look at that. All right. So this is an interesting question. How much money did you save prior to starting PA school, and how much would you recommend to save?
You know, I went into PA school with less than $10,000 to my name. I worked a lot in undergrad, so I had some savings, but not a ton. And I took out loans for all tuition. So I think I paid for we had to have an iPad. So I think I may have paid for my iPad and some of my initial books and things. But I would say my savings didn't get me very far, honestly. It was all mostly debt.
Yeah, I mean, I think if you can save a bunch before PA school, that's awesome.
Right.
Just to give yourself some like cushioning, or I mean, yeah, if you could pay for PA school right out the gate, that'd be really cool. But most of us in this world need loans, myself included. But I will say, so just in contrast, I went to a public school, so it was much. I say affordable, but it's not affordable. It's still very expensive. And so I've written on the PA platform in a blog about kind of my experience, because I paid back mine in about 14 months, but I didn't even have like half of what you had. So I think I ended up paying back around $75,000 when all was said and done. So
so fast. I mean,
yeah, and I was doing the same thing. Like I was throwing anything extra at my loans. I was buying and reselling clothes on Poshmark. Like, I mean, anything. I was babysitting, like anything I could do to get an extra few dollars, and then like throwing it at my loans. So, I just didn't like them. Like I
know
they're like a weight that needed to be gone. Okay, let's see what else we got. More about your job. Did they do any additional on-the-job training from cardiology to critical care regarding procedures, or did you already kind of feel comfortable? I guess, how did they make sure you were ready to go?
So in general, in order to do any procedure on any patient, you have to have privileges from the hospital. In order to get privileges for almost anything, you have to show a certain number of procedures, that specific procedure, that have been proctored by someone else who already has privileges. So there was a lot of training. I went first, before I knew I took the job, before I had even started, I went to a conference specifically on procedures. So I knew I could at least have some base knowledge. And then I was trained by all the other advanced practice providers that were more experienced and had been there longer, and they proctored me. So they taught me their way of doing it, monitored me doing it, checked off my forms that I did everything appropriately. And then I had to have those forms all submitted to the hospital. The credentialing committee reviewed them all, and then I was granted privileges. So in general, you have to have training or something. The hospital's not going to allow you to just go around poke patients,
which is a good thing. Yeah. Okay, so what did somebody ask? I lost the question. Hold on. That was a good question. Oh, no, somebody just commented that nobody really talks about financial stuff a lot, which is true. And that's why I think I think it's good to be transparent and stuff. And then someone else said, would it be possible to hear a chat or panel about the financial side of PA school in the future? And you can do that. So yeah, Kristin and I already talked and recorded a podcast episode that will be up next Friday. Yeah. And then in her course, you can hear all about finances in general and apply them to things about PA school. And I think we'll definitely continue talking about things like that in the future as well. Let's see. People want to know what your patient care hours were before PA school.
I was a CNA. I worked in a memory care unit, And, it wasn't something I wanted to do forever, but I loved it actually at the time.
That's interesting. I was a CNA and it was like a whole rehab hospital.
Oh.
But the memory care unit was my favorite section. Like I really enjoyed that part of the hospital, for sure. So let's see. When you interview for, okay, these kind of go together. When you interview for PA jobs, what questions should you be asking? And there's some questions about like, what should a job pay for as far as like insurance, liability, healthcare insurance? Like, what are your thoughts on some of that?
Good question. So honestly, you have to come to your interview with a very long list of questions. And then also, I feel very strongly you should never take a job without actually spending like a full day with a practicing APP that works there already. So I would ask like, what do you do during the day? I would specifically ask, autonomy. One way that I found that is an easier way to gauge autonomy than outright asking is to ask about the billing. So like some groups won't allow their advanced practice providers to bill at all. So then you automatically know your autonomy is going to be on the lower end. So that's kind of been a secret weapon question I've asked before to try to navigate that, because sometimes people aren't forthcoming. I would ask, you can tell little things like when you're asking them about PAs, if they say physician's assistant with an apostrophe, or if they are still saying like mid-level provider, you can kind of gauge that maybe they're not a routine employer of APPs, or maybe they're not up to date on the latest legislature, so they may not be sort of on the forefront as far as scope of practice. So I would try to find out things like that. Obviously, you need to know things like how much you're going to be paid and your CME and all those things. So that kind of leads into the second part. Most jobs have a CME budget, which honestly, I probably wouldn't take a full-time job that didn't have one. You have to learn, and those conferences are expensive. So CME, they should pay your medical liability coverage, and it should include tail coverage. And if they don't include tail coverage, I would highly reconsider, honestly, because you have to have tail coverage and it's extremely expensive. So that should be covered. Most places will cover your license. If you prescribe controlled substances, they'll pay for your CSR and DEA. And if they don't, you may, I don't know if you shouldn't take the job, but you need to have a salary that accounts for that, because those things are very expensive. And if you are not factoring that in when comparing jobs, you're going to be out multiple thousands of dollars.
Yes. And it's like the little things add up to your kind of total package that you have to look at. And so I think, like definitely look at all of those different benefits. Tail coverage is like it's a specific like malpractice thing. Like if you left a job, you'd still be covered. So at my previous job, I actually ended up having to buy tail coverage because and it wasn't so bad. Like basically I'd been told I had it, but then our practice merged with another one and our insurance policy changed. And then I was not told that from that point forward, I was not covered.
Wow.
So it wasn't like for the whole time I was there. But even then I think like it was like 2 or 3 years worth was like $2,500. So it was a nice little unexpected expense.
Right.
So, I mean, I think that like, it's definitely, again, something to talk about. And like, I always say have a written contract, because I don't know how you feel about that. I have some friends who work in jobs where they don't have a written contract. And I'm like, that's a really easy, great way to get screwed over. Like, just have it written down. Like, even if it's a Word document, like have it written down. So anyway, okay. I think this will be a nice question to kind of wrap up with. What are your goals for the rest of your PA medical career? And somebody else kind of asked, like, do you ever see yourself going back to day shift, or what do you kind of see as your PA future?
Gosh, honestly, I'm not entirely sure. I do know I will not work nights forever, just because there are health implications and it's hard to sort of keep a healthy lifestyle while working night shift. So for now, it's great. But that part of it, at some point I'll absolutely go back to some version of a day job, I guess. And, right now I'm affiliate faculty at the place that I went to PA school at and do some lectures for them and precept students. So at some point I'd probably like to do some version of academia, whether it's full-time or part-time, I'm not sure. But that's the nice part about being a PA, right? There's endless options, and I could do dermatology next if I felt like it.
Highly recommend. Okay. So to wrap up here, I wanted to tell y'all about a couple events coming up. So if y'all go in the chat, well, number one, thank Kristin for her time, and then go follow her on Instagram. And just check out her blog. So if you go to that offer tab and click to check out her course, it'll take you to her website so you can learn more. And there are a lot of really great blog posts on there. I've kind of like binged them. So it's all good. But I'm like so interested in that and get so confused by financial stuff. So like when you make it easy for me, it's great. And so much easier. So, all right. Our next day in the life event will be with two PAs who both work in infectious disease. Non, who is one of our pre-PA coaches, and she's on Instagram at @ampersand.pa. So y'all may have seen her on there, but she works more inpatient infectious disease. And then we're going to have Joshua Watts, who is also infectious disease, but works more outpatient. So they are going to be talking about and comparing their positions, which will be really interesting, especially I think amid all the COVID stuff, which has affected everyone's job so strangely. But so that'll be on October 20. Let me say this right. 22nd is what I want to say. It's a Thursday. Yeah. October 22nd at 8 p.m. Eastern. So we will, in your replay link, there will be a replay email. There will be a link to sign up for that next one. If you want to watch that, it will be posting as well. The other thing I wanted to tell you all about is that and we've decided we're going to announce it like later in the week on Instagram, but I was talking to my friend Brian and he was like, go ahead and tell them. So, on January 2nd, if you want to mark your calendars, that's going to be our next pre-PA virtual conference. I don't know if anyone attended last time in May. If you did, let me know. But we're going to do another one that's going to be a little kind of same topics, but a little more geared to if you maybe aren't quite applying yet, or like to help you improve your like entire application versus right before you apply when you can't really, do too much more stuff. So we're going to have a lot of great speakers. It's going to be an all-day event like it was last time. But if you go to prepaconference.com, you can go ahead and pre-register for that. And we've set up the code FuturePA for you to get $5 off of that. So check it out, and I hope we see you there on January 2nd. So, all right. Well, thanks everyone for watching and tuning in. Y'all are great.
Thank you guys. I appreciate your time. Thanks for having me.
Final words.
I hope you go check out this course. If you have questions about kind of just how to get your money on track and what you should be doing, even as a student before you have a job, this course will have all your answers. And there's a promo code for $20 off in the offers tab. So make sure you check that out.
So it's PA promo. And I definitely like somebody said, like, it's not something people talk about a lot, and it's not something you'll learn about in PA school either. Right. Maybe some PA schools do, but not mine. So we need to have nothing. And so we'll be talking more about that on the podcast episode too. But yeah, definitely check it out. And then if you have any questions, let us know.
Absolutely. Thanks, guys.
Bye, guys.